I'm an assistant professor in the community psychology program at Wilfrid Laurier University in Canada. And I'm going to talk about some research that we've done looking at patterns and effects of social integration on housing, mental health, and substance use outcomes among a Housing First randomized controlled trial. Just want to acknowledge my research team here. We worked with a number of research assistants in Waterloo. This was a very multi-site, large, comprehensive study, and then also some principal investigators in Toronto. Access to housing is a human right. Lack of affordable, safe housing is a significant driver of the homelessness issue in Canada. And homelessness continues to be a significant issue in our country, with 35,000 Canadians homeless on any given night, and a significant number, 365,000 homeless in a year. Housing First is an evidence-based program designed to end chronic homelessness. Housing First clients are provided with permanent housing without prerequisites for sobriety, and it's essentially a really wide-reaching, comprehensive program that provides supports through services as well. And a key focus of this program is to also reintegrate participants into their communities, to essentially reclaim a place. As a result, this can be a foundational step in moving towards with recovery as well. Community integration can be defined as the extent to which homeless people are able to live, work, learn, and participate in their communities, and it can have a social, physical, and psychological component. Housing First research has typically looked at the direct effects of the Housing First intervention on social and community integration, but there's been a lack of consistent findings with respect to that direct effect. Fewer studies have actually looked at how social integration can moderate or mediate outcomes like housing stability, mental health, and substance use. And that was a significant gap that we were looking to focus on in our analyses. So our research questions included: how does social integration change over time among participants in the Housing First versus treatment as usual groups in our randomized controlled trial? And then also, how do changes in social integration affect or mediate other key outcomes like housing stability and health outcomes? So we used data from the at-home Chez Soi project, which is a large randomized controlled trial conducted in Canada. It was actually the largest Housing First trial that's ever been conducted, and it happened in 5 cities in our country. It was also a mixed methods evaluation design that incorporated quantitative and qualitative data, and 2,148 individuals were enrolled, with almost half randomized to a Housing First intervention and the other half randomized to a treatment as usual group. These are just some of our outcome measures that we'll be looking at today, but the study involved quantitative surveys at baseline and at 3-month intervals up until 24 months. And other quantitative measures that were the predictors in our analyses. This is how we operationalize social integration, looking at things like social network size, psychological integration and sense of belongingness in the community, and also physical integration, so the extent to which people were actually engaging with different resources. With respect to findings, we found that social network size increased over time for all participants, but significantly more for our Housing First participants. We didn't find significant effects of changes in our community integration variables. We found that receiving Housing First increased participant social network size, which then in turn actually increased the percentage of days stably housed among our participants, so indicative of a mediation effect of social integration on housing stability. With respect to our qualitative data, we heard very clearly from participants that they felt more involved in their communities through accessing services through their service teams as part of the intervention, and also a greater sense of belonging and opportunities to meet new neighbors, and that this increased feelings of self-worth and self-esteem. Reconnection with previous relationships and family members was also important, and we heard very clearly that housing was a key catalyst in this process. But we also heard that some participants felt socially isolated and like they didn't necessarily belong because of significant differences in income representative in their neighborhood. So just to wrap up, key findings were that Housing First participants experienced increased greater social integration over time through increased social network size, and then that affected housing stability. And we need to really make sure that our housing and supported housing programs in particular are really fostering and supporting and promoting increase social integration for these interventions to essentially achieve positive outcomes. Please ask me about what some of those key ingredients to fostering better social integration might be in the discussion period. Thank you.